Hi folks, so this is the first of a new venture for me and vlogging. This is in addition to the vlog I do normally. What we've agreed at the executive team is it will be really helpful for me to talk to you about what we discuss every week at the executive leadership team, ELT for short. Because it all affects you. The reason we meet is about this organisation and making sure that we perform well, making sure that we respond to your needs, making sure that we act as a participant in the system of Wirral and Cheshire East. So last week we discussed making significant investment in organisational development and in your well-being, and you're going to hear more about that from our HR team and our operations teams in the forthcoming weeks. We also discussed this week the interim arrangements to redevelop the walk-in centre at Arrow Park. I think for anybody working there and for those of you who have been in there, it really does need some updating and making brighter and a nicer place to be. So we're doing that. The work started yesterday. I believe the walk-in centre team are thrilled about that. But I'd also say thank you to them and staff who use that service for their patience, because it's going to take a little bit of time to do it. But this is an interim solution, if you like, whilst we work with partners to develop what we want as a urgent treatment centre for Wirral. And I think that's probably going to be easily around about somewhere between 12 and 24 months. So we need to make that place a nice place to work and a nice place for patients whilst we're doing that work. I also wanted to mention flu vaccinations. Now look, we're slightly behind the curve on last year, but that's okay, there's plenty of time. But I really have looked at the stats this morning with the team, and some areas where I would expect the uptake to be a lot higher, it isn't. So if you're having problems getting a vaccination, contact the dedicated email address. It's on Staff Zone for you to access, and they'll come to you if they need to. But for goodness sake, please safeguard yourself, look after your patients and your family, get your flu vaccine, please. We are required by NHS England to hit an 80% target this year. It's greater than it's ever been, and we're nowhere near it yet. We're around about 60%. So make a big concerted effort. If you have a problem getting to somewhere, they'll come to you. Okay, we've also been talking today about the development of a procurement service with a partner organisation. So what we've agreed is for our procurement team, led by Tracy, to work with CWP to look at whether we can actually offer a service that's bigger, better, more efficient. So just explore those opportunities, not just in terms of the services that we provide, but how they procure. So potentially utilising the public purse in a more efficient way when we buy in stuff for our staff to use with their patients. In addition to the Arrow Park work, we've also been looking at some of the metrics around system flow. So this, if you like, this is about patients moving through our services into hospital, out of hospital, and how we respond. And I know how much effort and work has gone in over the last months to improving our position for this year. And guess what, guys? It started to have serious traction. Check out Twitter, you'll see last week it really is. The stats are going up. We're really making a difference. So to everybody who's been involved either in planning or delivering that service, you're really making a difference. Thank you so much. I'm sure if patients could thank you, they would. We don't want people languishing in hospital. We really don't. We want them out at home and starting to be with their families, starting to live well again. Finally, and then I will stop, we've got the chief nurse from NHS England visiting us next Wednesday. This is a magnificent opportunity to showcase what we do really well, and for all of you who know that, you know, knock yourselves out, show her what you do, be proud that you work for us, be proud of what you do. You have every right to be that because you are fabulous. You know you're fabulous, but tell her you're fabulous as well. Okay, so that's it really. We thought it would be a good idea. Each week I will give you a flavour of all the things we talk about at the executive leadership team when we make decisions that affect you I will tell you what those decisions are, and if you want more information, you can ask your line manager, or if you want to ask me anything or send me anything in terms of questions, or actually what you think of this idea. Does it hit the sweet spot? Let me know. But I'll keep doing it until you tell me to just stop. Okay. I guess the final thing to say is, please understand, if this is overkill, you need to tell me. I am very, very cognizant of the fact that as we develop place-based care systems, the role of the chief executive is changing significantly, and it's not enough anymore to be in your organisation and visible. I have to be in my organisation, in the place-based system, but I also have to be accountable at a regional level. So in terms of physical visibility, it's getting really difficult for me unless I clone myself. So this is an opportunity for me to try to get closer to you using the medium of a vlog. If you think that is helpful, tell me and I'll continue. If you don't, and you've got a better idea, tell me that too, and I'll do my best to meet your needs. I really will. My job is to make you magnificent and help you to deliver the services you need to deliver. So just let me know, okay? Over and out. Thanks.